Hello and welcome to Digital Medboard. Here we go. We have three cerebral arteries: the anterior cerebral artery, the middle cerebral artery, and the posterior cerebral artery. The internal carotid artery runs in the lateral sulcus, supplying Broca's motor area, the arcuate fasciculus, and the Wernicke's sensory area. The anterior cerebral artery runs anteriorly and medially, supplying the anteromedial region. We are observing the lateral aspect of the cerebrum and the medial aspect of the cerebrum, and this is called the central sulcus. For example, imagine if the body is represented upside down on the central sulcus. We would observe the head and the upper limb with a part of pelvis peritoneum in the lateral cerebrum. However, the lower limb located in the paracentral lobule and a part of pelvis peritoneum can only be viewed from the medial aspect of the brain. The central sulcus separates the frontal motor cortex from the parietal sensory cortex. If an artery supplying the head region of the sulcus is damaged, motor and sensory deficits will occur in the brain's head region. Damage to the region supplying the upper limb results in the sensory and motor deficits in the upper limb region. If the artery supplying the paracentral lobule is damaged, it may cause lower limb and the pelvis peritoneum deficits. The anterior cerebral artery primarily supplies the medial cerebrum, while the middle cerebral artery primarily supplies the lateral cerebrum. Most of the corpus callosum and the fornix are supplied by anterior cerebral artery, while the posterior end of these structures are supplied by the posterior cerebral artery. Damage to the posterior cerebral artery can lead to contralateral homonymous hemianopia. The middle cerebral artery also supplies some visual input to the macular area in the posterior part of the brain, and damage may result in macular sparring. Now we are going to discuss about the neurological symptoms of these three vascular territories. At first, anterior cerebral artery deficits causes paralysis of lower limb with bladder dysfunction in the paracentral lobule. Next, middle cerebral artery deficits causes partial paralysis with aphasia in the lateral cerebrum. And then posterior cerebral artery deficits causes hemisensory losses with hemianopia in the thalamus region, and also causes Dejerine-Roussy syndrome. We got a question. A patient presented with clinical features of ataxia and incoordination. It is most likely due to involvement of which artery among the following? Let's discuss in detail. Ataxia can have various types, such as cerebellar ataxia or vitamin B12 deficiency ataxia, and incoordination suggests cerebellar ataxia, as the cerebellum is responsible for voluntary motor coordination. Anterior cerebral artery damage typically causes social inhibition. Next, the middle cerebral artery often results in aphasia and motor sensory deficits. Posterior cerebral artery damage presents with contralateral homonymous hemianopia. So based on the information provided, ataxia and incoordination indicates involvement of superior cerebellar artery. Therefore, option D is the correct answer. That's the end of the session. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? drop them in the comments below. See you in the next video. Until then, stay tuned. Cheers.